Question 1. Examination of the data shows a patient with type 2 diabetes, recently diagnosed, expresses significant feelings of overwhelm and discouragement, stating, "I just don't know how I'm going to manage all of this. It feels impossible." The diabetes educator needs to address these feelings to facilitate effective self-management. Which of the following approaches best supports the patient in developing coping strategies? Option A. Initiate a discussion to identify the specific aspects of diabetes management that are causing the most distress and collaboratively brainstorm personalized strategies to address these challenges. Option B. Provide the patient with a comprehensive pamphlet detailing various stress reduction techniques and encourage them to try them at home. Option C. Advise the patient to focus solely on adhering to their medication schedule, as this is the most critical component of managing diabetes. Option D. Reassure the patient that these feelings are common and proceed with the standard educational curriculum on diet and exercise. Correct answer is A. Initiate a discussion to identify the specific aspects of diabetes management that are causing the most distress and collaboratively brainstorm personalized strategies to address these challenges. Explanation. Scenario analysis. This scenario presents a common challenge in diabetes education where a patient's emotional distress significantly impacts their self-management. The educator must balance providing evidence-based information with acknowledging and addressing the patient's psychological state, which is crucial for effective coping and adherence to treatment plans. The challenge lies in identifying the root cause of the distress and tailoring interventions accordingly, rather than offering generic advice. Correct approach analysis. The correct approach involves a structured, empathetic, and patient-centered assessment to understand the specific stressors contributing to the patient's feelings of overwhelm. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that interventions are helpful and do not cause further harm. It also adheres to professional guidelines that emphasize the importance of addressing psychosocial factors in chronic disease management. By exploring the patient's specific concerns and collaboratively developing personalized strategies, the educator empowers the patient and fosters a sense of agency, which is a cornerstone of effective diabetes self-management education. This approach respects the patient's autonomy and promotes a therapeutic relationship built on trust and understanding. Incorrect approaches analysis. One incorrect approach involves immediately providing a list of general coping mechanisms without first understanding the patient's individual situation. This fails to acknowledge the unique nature of the patient's distress and may lead to irrelevant or ineffective suggestions, potentially increasing frustration. Ethically, this approach neglects the principle of individualized care and may violate the educator's duty to provide relevant and helpful support. Another incorrect approach is to dismiss the patient's feelings as a normal part of living with diabetes and proceed with routine education. This demonstrates a lack of empathy and fails to recognize the potential for significant psychological impact that can impede self-care. Professionally, this can be seen as a failure to adequately assess the patient's needs and can undermine the therapeutic alliance, leading to disengagement and poorer health outcomes. It also overlooks the importance of mental well-being in managing a chronic condition. A third incorrect approach is to focus solely on the physiological aspects of diabetes management, such as diet and exercise, without addressing the emotional component. While these are critical, ignoring the patient's emotional state means addressing only a part of the problem. This can lead to a disconnect between the patient's understanding of what they should do and their ability to actually implement it due to emotional barriers. This approach is ethically problematic as it does not provide holistic care. Professional reasoning. When faced with a patient expressing overwhelm, a diabetes educator should first engage in active listening and empathetic inquiry to understand the specific sources of their distress. This involves asking open-ended questions about their challenges, fears, and perceived barriers to self-management. Following this assessment, the educator should collaboratively explore coping strategies that are tailored to the patient's individual circumstances, preferences, and available resources. This might include problem-solving techniques, stress management exercises, or connecting the patient with support groups or mental health professionals if indicated. The process should be iterative, with ongoing assessment and adjustment of strategies as needed, always prioritizing the patient's well-being and empowerment. Question 2. The audit findings indicate a need to refine how certified diabetes educators, CDE, Communicate the benefits of exercise for blood glucose control. Which of the following educational approaches best reflects current professional standards and ethical obligations for CDEs in this context? Option A. Focus on the immediate post-exercise drop in blood glucose, advising patients to monitor their levels closely for a few hours after each session to prevent hypoglycemia. Option B. Share personal anecdotes and success stories of individuals who have significantly improved their blood glucose control through exercise, encouraging patients to replicate these experiences. Option C. Emphasize how regular physical activity enhances insulin sensitivity and improves the body's ability to use glucose, leading to more stable blood glucose levels over time, while also discussing strategies for safe exercise initiation and progression tailored to the individual's health status and preferences. Option D. Provide a general overview of the physiological processes involved in exercise-induced glucose uptake, without delving into specific patient recommendations or potential risks. The correct answer is C. Emphasize how regular physical activity enhances insulin sensitivity and improves the body's ability to use glucose, leading to more stable blood glucose levels over time, while also discussing strategies for safe exercise initiation and progression tailored to the individual's health status and preferences. Explanation. The audit findings indicate a need to reinforce the understanding of exercise benefits for blood glucose control among certified diabetes educators, CDE. This scenario is professionally challenging because while the general benefits of exercise are widely accepted, the nuanced application and communication of these benefits to diverse patient populations require precise knowledge and adherence to best practices, as outlined by relevant professional guidelines. Ensuring that CDEs can accurately and effectively convey this information is crucial for patient empowerment and optimal diabetes management. The correct approach represents best professional practice because it aligns with the core competencies expected of a CDE, emphasizing patient-centered education grounded in evidence-based principles. This approach prioritizes tailoring information to individual patient needs and capabilities, a cornerstone of effective diabetes self-management education and support. It also implicitly supports the ethical obligation to provide accurate, understandable, and actionable health information, thereby promoting patient autonomy and well-being. Adherence to professional standards ensures that education is not only informative, but also practical and safe for the individual. An incorrect approach that focuses solely on the broad physiological mechanisms of exercise without considering individual patient factors fails to meet the educational needs of the patient. This is a regulatory and ethical failure because it neglects the principle of individualized care, which is fundamental to diabetes education. Patients require education that is relevant to their specific health status, lifestyle, and potential barriers to exercise. Providing generic information can be overwhelming, demotivating, and potentially unsafe if it doesn't account for comorbidities or exercise contraindications. Another incorrect approach that emphasizes the immediate, short-term effects of exercise on blood glucose without discussing long-term benefits or potential risks is also professionally unacceptable. This represents a failure to provide comprehensive education. The ethical obligation is to equip patients with a holistic understanding of how exercise impacts their diabetes management, including sustained improvements in insulin sensitivity, cardiovascular health, and weight management, as well as awareness of potential hypoglycemia or other exercise-related risks. Focusing only on immediate effects can lead to a misunderstanding of the overall value of exercise and may not foster long-term adherence. A further incorrect approach that relies on anecdotal evidence or unverified claims about exercise benefits is a direct violation of professional standards and ethical guidelines. CDEs are expected to base their education on scientific evidence and established clinical guidelines. Relying on anecdotal information can lead to the dissemination of misinformation, potentially harming patients by promoting ineffective or even dangerous practices. This undermines the credibility of the CDE and the profession. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's current knowledge, readiness to learn, and individual circumstances. 2. Identify the specific educational goals related to exercise and blood glucose control. 3. Select evidence-based information that is relevant and understandable to the patient. 4. Tailor the information to address the patient's unique needs, preferences, and potential barriers. 5. Discuss both the benefits and potential risks of exercise, ensuring the patient understands how to manage them. 6. Empower the patient to make informed decisions about incorporating exercise into their diabetes management plan. 7. Continuously evaluate the effectiveness of the education and adjust as needed. Question 3. To address the challenge of a patient who expresses frustration with frequent blood glucose monitoring and expresses skepticism about the long-term impact of their current lifestyle choices on developing serious diabetes-related complications, which of the following educational approaches would be most effective in promoting adherence and preventing microvascular and macrovascular issues? Option A. Deliver a comprehensive lecture detailing the statistical probabilities of developing retinopathy, nephropathy, and cardiovascular disease if current lifestyle habits persist, emphasizing the severity and inevitability of these outcomes. Option B. Acknowledge the patient's frustration, but gently steer the conversation away from the topic of complications, focusing solely on immediate blood glucose targets to avoid overwhelming them. Option C. Engage in a collaborative discussion, exploring the patient's specific concerns and barriers to adherence, then use motivational interviewing techniques to help them identify personal values and goals, and co-create small, achievable steps towards improved self-management, linking these steps to tangible, relatable long-term health outcomes. Option D. Express concern about the patient's lack of motivation and inform them that, without a significant change in attitude, further education on complication prevention will be unproductive. The correct answer is C. Engage in a collaborative discussion, exploring the patient's specific concerns and barriers to adherence, then use motivational interviewing techniques to help them identify personal values and goals, and co-create small, achievable steps towards improved self-management, linking these steps to tangible, relatable long-term health outcomes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified diabetes educator, CDE, to navigate a patient's complex emotional and practical barriers to managing their diabetes, which directly impacts the prevention of long-term microvascular and macrovascular complications. The patient's resistance to lifestyle changes, coupled with their perceived lack of understanding of the severity of these complications, necessitates a nuanced and empathetic approach. CDE must balance providing accurate, evidence-based information with fostering patient autonomy and motivation, all while adhering to professional standards of care and patient-centered education. Correct approach analysis. The correct approach prioritizes a collaborative and empathetic strategy. It involves actively listening to the patient's concerns, validating their feelings, and then using motivational interviewing techniques to explore their readiness for change. By linking current behaviors to specific, relatable long-term complications, e.g., vision loss, kidney disease, cardiovascular events, and co-creating a personalized, achievable action plan, the CDE empowers the patient. This aligns with the ethical principles of beneficence, acting in the patient's best interest and autonomy, respecting the patient's right to make decisions about their care. Professional guidelines for diabetes education emphasize patient-centered care, shared decision-making, and the use of evidence-based educational strategies to promote self-management and prevent complications. Incorrect approach is analysis, an approach that solely focuses on delivering a lecture about the statistical risks of complications without addressing the patient's emotional state or practical barriers is ethically flawed. It fails to respect patient autonomy by not engaging them in the educational process and may be perceived as paternalistic, potentially leading to further disengagement and non-adherence. This approach neglects the principle of patient-centered care, which is a cornerstone of effective diabetes education. An approach that dismisses the patient's concerns as simply not wanting to change and resorting to a directive, authoritative tone is also professionally unacceptable. This can damage the therapeutic relationship, erode trust, and create a hostile learning environment. It violates the ethical principle of non-maleficence by potentially causing psychological distress and hindering the patient's ability to manage their condition effectively. Furthermore, it fails to adhere to professional standards that advocate for a supportive and non-judgmental educational environment, an approach that avoids discussing the long-term complications altogether due to the patient's apparent resistance is a failure to uphold the CDE's professional responsibility to educate patients about the full spectrum of their condition and its potential consequences. While sensitivity is crucial, complete avoidance prevents the patient from understanding the why behind recommended lifestyle modifications, thus undermining the long-term goal of complication prevention. This can be seen as a breach of the duty to inform and educate, which is a core ethical obligation. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough assessment of the patient's current understanding, beliefs, values, and readiness for change. This involves active listening and empathetic communication. The next step is to tailor educational interventions to the individual's needs and preferences, utilizing evidence-based strategies like motivational interviewing. Professionals must continuously evaluate the effectiveness of their interventions and adjust their approach as needed, always prioritizing the patient's well-being and fostering a collaborative partnership. Adherence to professional codes of ethics and regulatory guidelines for diabetes education is paramount throughout this process. Question 4. Analysis of how a certified diabetes educator, CDE, should approach carbohydrate counting and meal planning for a new patient with type 2 diabetes, considering the patient's stated preference for traditional cultural dishes and a busy work schedule, and the CDE's ethical obligation to provide individualized and effective care. Option A. Develop a personalized meal plan that incorporates the patient's preferred cultural dishes by identifying carbohydrate sources within those meals and suggesting portion adjustments, while also offering strategies for managing carbohydrate intake during busy workdays, such as pre-portioned snacks. Option B. Provide the patient with a generic list of low-carbohydrate foods and a standardized meal plan, instructing them to adapt it as best as they can to their cultural preferences and work schedule. Option C. Focus exclusively on teaching the patient how to count carbohydrates using a standard food exchange list, without delving into specific meal examples or considering their cultural background or work constraints. Option D. Recommend a strict ketogenic diet as the primary intervention, emphasizing its effectiveness in blood glucose control, and expect the patient to modify their cultural dishes to fit this restrictive eating pattern. The correct answer is A. Develop a personalized meal plan that incorporates the patient's preferred cultural dishes by identifying carbohydrate sources within those meals and suggesting portion adjustments, while also offering strategies for managing carbohydrate intake during busy workdays, such as pre-portioned snacks. Explanation. This scenario presents a common challenge in diabetes education. Tailoring carbohydrate counting and meal planning advice to an individual's unique lifestyle, cultural background, and personal preferences, while adhering to evidence-based guidelines. The professional challenge lies in balancing the scientific principles of carbohydrate management with the practical realities of a patient's daily life, ensuring the plan is not only effective, but also sustainable and culturally sensitive. Careful judgment is required to avoid imposing a rigid, one-size-fits-all approach that can lead to non-adherence and suboptimal health outcomes. The correct approach represents best professional practice because it prioritizes a collaborative and individualized strategy. By actively involving the patient in identifying their preferred foods, typical meal patterns, and cultural considerations, the educator fosters a sense of ownership and empowerment. This patient-centered methodology aligns with ethical principles of autonomy and beneficence, ensuring the meal plan is realistic, enjoyable, and therefore more likely to be followed consistently. Furthermore, it adheres to the professional guidelines of the Certified Diabetes Educator, CDE certification, which emphasize personalized care and the integration of social determinants of health into diabetes management. This approach ensures that the carbohydrate counting and meal planning advice is not just theoretically sound, but practically applicable and respectful of the individual's circumstances. An incorrect approach that focuses solely on providing a generic list of carbohydrate-containing foods and portion sizes without considering the patient's individual context fails to meet professional standards. This approach neglects the crucial element of personalization, potentially leading to a meal plan that is difficult to follow, culturally inappropriate, or simply not aligned with the patient's eating habits. Ethically, this can be seen as a failure to provide truly individualized care, potentially leading to frustration and disengagement from the patient. Another incorrect approach that relies heavily on strict adherence to a predefined meal plan without flexibility or patient input disregards the dynamic nature of daily life and the importance of patient autonomy. This rigid method can create undue stress and anxiety for the patient, making adherence challenging and potentially leading to feelings of failure. It fails to acknowledge that effective diabetes management requires adaptability, and that plan must be integrated into, rather than imposed upon, a person's life. A third incorrect approach that prioritizes low-carbohydrate diets as the only effective strategy, without assessing the patient's readiness, preferences, or potential contraindications, is also professionally unsound. While low-carbohydrate approaches can be beneficial for some individuals, mandating them without a thorough assessment and shared decision-making process can be detrimental. It overlooks the diversity of effective diabetes management strategies and the importance of patient choice, potentially leading to a plan that is unsustainable or even harmful if not appropriate for the individual. The professional decision-making process for similar situations should begin with a comprehensive assessment of the patient's current knowledge, skills, beliefs, cultural background, socioeconomic factors, and personal preferences related to food and eating. This should be followed by a collaborative discussion to establish realistic goals and identify preferred strategies for carbohydrate counting and meal planning. The educator should then present evidence-based options, explaining the rationale behind each, and work with the patient to develop a personalized plan that is flexible, sustainable, and culturally sensitive. Ongoing monitoring, evaluation, and adjustment of the plan based on the patient's feedback and outcomes are essential components of effective diabetes education. Question 5. The efficiency study reveals that a patient with type 2 diabetes, who is reportedly adherent to their metformin and sulfonylurea regimen, continues to exhibit an HbA1c of 8.5% despite consistent lifestyle modification efforts. The patient reports no significant changes in their daily routine or diet. Considering the potential for micronutrient imbalances to influence metabolic pathways, which of the following represents the most appropriate next step for the certified diabetes educator to explore? Option A. Discuss the possibility of a micronutrient deficiency impacting glucose metabolism and explore dietary intake patterns for potential gaps, considering common micronutrients implicated in insulin sensitivity and glucose regulation. Option B. Advise the patient that micronutrients are unlikely to be a significant factor in their current glycemic control and focus solely on reinforcing existing lifestyle advice. Option C. Recommend an immediate increase in the dosage of the patient's current oral diabetes medications to achieve target glycemic control. Option D. Refer the patient directly to an endocrinologist for further investigation, without exploring potential nutritional influences within the CDE's scope of practice. The correct answer is A. Discuss the possibility of a micronutrient deficiency impacting glucose metabolism and explore dietary intake patterns for potential gaps, considering common micronutrients implicated in insulin sensitivity and glucose regulation. Explanation. The efficiency study reveals that a significant portion of individuals with type 2 diabetes are experiencing suboptimal glycemic control despite adherence to prescribed medications. This scenario is professionally challenging because it necessitates a nuanced understanding beyond standard glycemic targets. It requires the certified diabetes educator, CDE, to consider multifactorial influences on diabetes management, including micronutrient status, which can impact insulin sensitivity, glucose metabolism, and overall health. Careful judgment is required to differentiate between medication non-adherence, lifestyle factors, and potential underlying nutritional deficiencies that might be hindering progress. The correct approach represents best professional practice because it prioritizes a holistic and evidence-based assessment. By considering micronutrient status, the CDE is acting within the scope of practice for diabetes education, which includes advising on nutrition and lifestyle modifications that support optimal health outcomes for individuals with diabetes. This approach aligns with the ethical principle of beneficence, aiming to provide the best possible care and improve patient well-being. It also reflects a commitment to patient-centered care by investigating all potential contributing factors to the patient's condition. Furthermore, it adheres to guidelines that encourage comprehensive assessment and individualized care plans for individuals with diabetes. An incorrect approach that focuses solely on increasing medication dosage without investigating other contributing factors fails to address the root cause of suboptimal control. This could lead to unnecessary polypharmacy, increased risk of side effects, and patient dissatisfaction, potentially violating the ethical principle of non-maleficence by exposing the patient to risks without clear benefit. It also represents a failure to adhere to best practices in diabetes management, which advocate for a comprehensive, individualized approach. Another incorrect approach that dismisses the role of micronutrients based on a lack of direct evidence for specific micronutrient supplementation in all diabetes cases overlooks the complex interplay between nutrition and metabolic health. While not all micronutrient deficiencies are directly causal for poor glycemic control, certain deficiencies can exacerbate insulin resistance or impair cellular function, indirectly affecting glucose metabolism. This approach may also be considered a failure to provide thorough patient education and support, as it prematurely closes off avenues of investigation that could benefit the patient. A further incorrect approach that suggests referring the patient to a specialist without conducting an initial assessment of potential micronutrient considerations is inefficient and may delay appropriate interventions. While specialist referral is sometimes necessary, a CDE's role includes initial screening and assessment of common contributing factors. This premature referral could be seen as a failure to utilize the CDE's expertise and could lead to unnecessary healthcare costs for the patient. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Gather detailed patient history including diet, lifestyle, medication adherence, and symptomology. 2. Evidence-based inquiry. Consider potential contributing factors supported by current scientific literature and professional guidelines. 3. Individualized care planning. Develop a plan tailored to the patient's specific needs, preferences, and circumstances. 4. Collaborative approach. Involve the patient in decision-making and collaborate with other healthcare professionals as needed. 5. Ongoing monitoring and evaluation. Regularly assess the effectiveness of interventions and adjust the care plan accordingly. Question 6. The evaluation methodology shows that certified diabetes educator is counseling a patient who expresses a desire to continue social drinking. The patient asks for guidance on how to manage their alcohol intake safely while living with diabetes. Which of the following approaches best reflects current best practices for providing this guidance? Option A. Discuss the patient's typical alcohol consumption, review their current diabetes medications and overall health status, and collaboratively develop personalized strategies for safe alcohol consumption, including monitoring and risk mitigation. Option B. Provide general information about alcohol's effects on blood sugar, but emphasize that individual responses vary so widely that no specific recommendations can be made beyond general healthy lifestyle advice. Option C. Advise the patient that complete abstinence from alcohol is the safest option for managing diabetes and recommend they avoid it entirely. Option D. Explain that the impact of alcohol on blood glucose is too variable and complex to provide specific advice, and suggest they monitor their blood glucose closely without further guidance on alcohol consumption. The correct answer is C. Advise the patient that complete abstinence from alcohol is the safest option for managing diabetes and recommend they avoid it entirely. Explanation. The evaluation methodology shows that certified diabetes educator, CDE, must navigate complex patient scenarios involving lifestyle choices that directly impact glycemic control. This particular scenario is professionally challenging because alcohol consumption is a common social behavior, and its impact on blood glucose is multifaceted and can vary significantly between individuals and even within the same individual on different occasions. A CDE must provide evidence-based, individualized advice that balances patient autonomy with the imperative to promote health and prevent complications. This requires a deep understanding of the physiological effects of alcohol, potential interactions with diabetes medications, and the patient's overall health status and self-management capabilities. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and collaborative goal setting. This aligns with the ethical principles of patient-centered care, beneficence, and non-maleficence. Specifically, it adheres to guidelines that emphasize the importance of understanding a patient's unique metabolic response, medication regimen, and personal circumstances before offering advice. This approach ensures that recommendations are safe, effective, and tailored to the individual, thereby maximizing the potential for positive health outcomes and minimizing risks. It also empowers the patient to make informed decisions about their lifestyle choices within a supportive framework. An incorrect approach that focuses solely on abstinence fails to acknowledge the reality of social drinking and may alienate the patient, leading to a breakdown in the therapeutic relationship and potentially driving the behavior underground. This approach is ethically problematic as it can be perceived as paternalistic and judgmental, infringing on patient autonomy without sufficient justification or exploration of alternatives. It also fails to provide practical, actionable advice for patients who choose to consume alcohol. Another incorrect approach that suggests ignoring alcohol's impact due to its complexity is professionally unacceptable. This demonstrates a failure to uphold the CDE's responsibility to provide comprehensive diabetes education and management support. It neglects a significant factor that can influence glycemic control and increase the risk of hypoglycemia or hyperglycemia, potentially leading to adverse health events. This approach is a dereliction of professional duty and a violation of the principle of beneficence. A third incorrect approach that relies on generalized advice without considering individual factors is also flawed. While general information about alcohol and diabetes is useful, applying it rigidly without assessing the individual's specific situation, medication, and typical consumption patterns can lead to inappropriate or even dangerous recommendations. This lacks the individualized care that is a cornerstone of effective diabetes education and management. The professional decision-making process for similar situations should involve a structured approach. 1. Assess the patient's current alcohol consumption patterns, including frequency, quantity, and type of alcohol. 2. Evaluate the patient's understanding of how alcohol affects their blood glucose levels and their diabetes management plan. 3. Review the patient's current diabetes medications and their potential interactions with alcohol. 4. Discuss the potential risks and benefits of alcohol consumption in the context of their individual health status and diabetes control. 5. Collaboratively develop personalized strategies for safe alcohol consumption if the patient chooses to drink, including monitoring blood glucose, timing of meals and medication, and recognizing signs of hypoglycemia. 6. Provide clear, actionable advice and resources for further support. Question 7. What factors determine the most appropriate diagnostic method for a patient suspected of having diabetes when considering fasting glucose, oral glucose tolerance tests (OGT), and HbA1c? Option A. The availability of specific laboratory equipment for each test. Option B. The patient's clinical presentation, risk factors, and the specific diagnostic criteria being applied. Option C. The presence of symptoms suggestive of diabetes, regardless of laboratory confirmation. Option D. The patient's expressed preference for a particular diagnostic test. The correct answer is B. The patient's clinical presentation, risk factors, and the specific diagnostic criteria being applied. Explanation. This scenario is professionally challenging because a certified diabetes educator, CDE, must interpret diagnostic criteria for diabetes with a high degree of accuracy, as misinterpretation can lead to delayed or incorrect diagnosis, impacting patient care and outcomes. The CDE must navigate the nuances of different diagnostic tests and their appropriate application, considering the patient's clinical presentation and history. The correct approach represents best professional practice because it aligns with established diagnostic guidelines for diabetes, ensuring that a diagnosis is made based on validated criteria. This upholds the professional responsibility to provide evidence-based care and ensures patient safety by avoiding premature or inaccurate diagnoses. Adherence to these guidelines is a core ethical and professional obligation for CDEs. An incorrect approach that relies solely on a single elevated fasting glucose reading without considering other diagnostic criteria or clinical context fails to adhere to the comprehensive diagnostic framework. This could lead to a false positive or false negative diagnosis, both of which have significant ethical and professional implications. Ethically, it breaches the duty of care by potentially subjecting a patient to unnecessary interventions or withholding necessary treatment. Professionally, it demonstrates a lack of understanding of diagnostic standards. Another incorrect approach that prioritizes patient preference for a specific test over established diagnostic protocols is also professionally unacceptable. While patient-centered care is important, it cannot supersede the requirement for accurate and reliable diagnostic methods. This approach risks compromising the integrity of the diagnostic process and could lead to misdiagnosis, violating professional standards, and potentially harming the patient. A third incorrect approach that focuses on symptoms alone without confirming with laboratory diagnostic criteria is ethically and professionally flawed. Symptoms can be indicative of diabetes, but they are not diagnostic in themselves. Relying solely on symptoms without objective laboratory confirmation can lead to delayed diagnosis if symptoms are atypical, or to unnecessary anxiety and intervention if symptoms are due to other causes. This deviates from the standard of care and professional responsibility. The professional decision-making process for similar situations should involve a thorough understanding of the current diagnostic guidelines for diabetes. This includes knowing the specific criteria for fasting plasma glucose, oral glucose tolerance tests (OGT), and HbA1c, as well as the circumstances under which each test is most appropriate. The CD must then apply these guidelines to the individual patient's situation, considering their clinical presentation, risk factors, and any previous test results. If there is any ambiguity or if results are borderline, consultation with a physician or other healthcare provider is essential to ensure an accurate and timely diagnosis. The ultimate goal is to provide safe, effective, and evidence-based care. Question 8. System analysis indicates that a 45-year-old individual presents with a recent diagnosis of hyperglycemia, a family history of diabetes in their mother and paternal grandfather, and a lean body habitus. They report experiencing gradual onset of symptoms over the past year, including increased thirst and fatigue. They have no history of diabetic ketoacidosis. Based on this information, which of the following diagnostic considerations is most critical for guiding initial management and further investigation? Option A. Focusing solely on HbA1c levels to determine the severity of hyperglycemia and guide immediate insulin initiation. Option B. Prioritizing genetic testing for monogenic diabetes, MODI, as the primary diagnostic step given the family history. Option C. Assuming type 2 diabetes due to the age of onset and family history, and initiating metformin therapy. Option D. Differentiating between autoimmune diabetes, type 1 or LADA, and non-autoimmune diabetes, type 2 or MODI, based on clinical presentation and potential autoantibody testing. The correct answer is D. Differentiating between autoimmune diabetes, type 1 or LADA, and non-autoimmune diabetes, type 2 or MODI, based on clinical presentation and potential autoantibody testing. Explanation: scenario analysis. This scenario is professionally challenging because accurately classifying diabetes is fundamental to effective patient care and management. Misclassification can lead to inappropriate treatment strategies, potentially causing suboptimal health outcomes, increased risk of complications, and patient dissatisfaction. The nuances between type 1, type 2, LADA, and MODI require a thorough understanding of their distinct pathophysiological mechanisms, genetic predispositions, and typical age of onset, demanding careful clinical judgment. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates clinical presentation, patient history, and diagnostic laboratory findings to differentiate between the various types of diabetes. This aligns with best professional practice as outlined by diabetes care guidelines, which emphasize accurate diagnosis for personalized treatment. For instance, identifying type 1 diabetes necessitates immediate insulin therapy, while type 2 may initially be managed with lifestyle modifications and oral agents. Recognizing LADA requires a slower, autoimmune-driven progression distinct from typical type 1, and MODI, a monogenic form, has specific genetic implications for family screening and treatment. This approach ensures adherence to evidence-based practice and patient safety. Incorrect approaches analysis. One incorrect approach would be to solely rely on the presence of hyperglycemia to initiate treatment without further classification. This fails to acknowledge the diverse etiologies of diabetes and can lead to delayed or incorrect therapeutic interventions. For example, treating a patient with MODI as if they have type 2 diabetes might result in ineffective management and missed opportunities for genetic counseling. Another incorrect approach would be to assume type 2 diabetes in all adult onset cases without considering autoimmune or genetic factors. This overlooks the possibility of LADA or certain forms of MODI, which require different management strategies. Ethically, this represents a failure to provide individualized care and could lead to adverse health consequences for the patient. A third incorrect approach would be to focus exclusively on autoantibody testing without considering the overall clinical picture. While autoantibodies are crucial for diagnosing autoimmune diabetes, type 1 and LADA, their absence does not rule out other forms, and their presence alone doesn't dictate the entire management plan without considering other clinical factors. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a detailed patient history, including age of onset, family history, weight status, and symptomology. This is followed by a thorough physical examination. Crucially, diagnostic investigations such as fasting plasma glucose, HbA1c, autoantibody testing, GAD65, IA2, insulin antibodies, and C-peptide levels are essential. For suspected MODI, genetic testing may be indicated. This multifaceted approach ensures accurate classification, leading to the most appropriate and effective patient management plan, adhering to professional standards and ethical obligations. Question 9. Regulatory review indicates that screening guidelines for diabetes in various populations are subject to specific recommendations based on age, risk factors, and demographic characteristics. A certified diabetes educator is reviewing a new patient's chart and needs to determine the most appropriate initial screening approach. Which of the following actions best aligns with current U.S. regulatory frameworks and best practices for diabetes screening? Option A. Apply a single generalized screening protocol to all patients, without differentiating based on specific population risk factors or individual characteristics. Option B. Conduct a comprehensive risk assessment based on established U.S. guidelines, considering factors such as age, body mass index, family history, ethnicity, and history of gestational diabetes before recommending screening. Option C. Rely solely on the presence of classic diabetes symptoms, such as increased thirst and frequent urination, to initiate screening. Option D. Implement a universal screening protocol for all adults over the age of 35, irrespective of other risk factors or symptoms. The correct answer is D. Implement a universal screening protocol for all adults over the age of 35, irrespective of other risk factors or symptoms. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Diabetes Educator, CDE, to navigate differing screening recommendations for diabetes based on age, risk factors, and specific population characteristics, all within the context of established U.S. regulatory frameworks and guidelines. The CDE must balance the need for early detection with the efficient allocation of resources and avoid unnecessary testing that could lead to patient anxiety or over-medicalization. The challenge lies in accurately applying the most current and relevant guidelines to a diverse patient population. Correct approach analysis. The correct approach involves a systematic assessment of the individual's risk factors and demographic profile against the established screening guidelines from reputable U.S. organizations such as the American Diabetes Association, ADA. This aligns with best professional practice by prioritizing evidence-based recommendations and ensuring that screening is targeted to those most likely to benefit from early detection and intervention. Adhering to these guidelines ensures compliance with the spirit of public health initiatives aimed at reducing the burden of diabetes and its complications. It reflects a commitment to patient-centered care by tailoring screening strategies to individual needs and risk profiles, thereby optimizing health outcomes and resource utilization. Incorrect approach is analysis. One incorrect approach is to screen all individuals over a certain age regardless of other risk factors. This fails to adhere to specific guidelines that recommend risk stratification, potentially leading to overscreening of low-risk individuals and underscreening of higher-risk individuals who might fall just below an arbitrary age cutoff. This approach is inefficient and may not align with the cost-effectiveness considerations embedded in public health recommendations. Another incorrect approach is to rely solely on patient-reported symptoms for screening. While symptoms are important indicators, many individuals with prediabetes or early-stage diabetes are asymptomatic. This approach risks missing diagnoses until the disease has progressed, leading to more severe complications and a greater burden on the healthcare system. It deviates from the proactive, preventative nature of recommended screening guidelines. A third incorrect approach is to apply a single, universal screening protocol to all individuals without considering specific population vulnerabilities, such as those identified in guidelines for certain ethnic groups or individuals with a history of gestational diabetes. This overlooks the nuanced recommendations that acknowledge differential risk within the population, potentially leading to disparities in care and missed opportunities for early intervention in at-risk subgroups. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough understanding of the current, U.S.-based screening guidelines for diabetes. This involves consulting authoritative sources like the ADA standards of care. The next step is to conduct a comprehensive patient assessment, gathering information on age, weight, family history, ethnicity, history of gestational diabetes, and other relevant risk factors. Based on this assessment, the CDE should then apply the appropriate screening criteria from the guidelines. This systematic, evidence-based approach ensures that screening is both effective and ethically sound, prioritizing patient well-being and adherence to regulatory expectations. Question 10. The assessment process reveals that a certified diabetes educator is working with a new patient who recently immigrated from Southeast Asia and speaks limited English. The patient expresses a strong preference for traditional family recipes and is concerned about how to incorporate these into a diabetes management plan while also managing a tight budget. What is the most appropriate initial nutrition education strategy for this patient? Option A. Advise the patient to avoid all traditional family recipes due to their perceived high carbohydrate content and suggest they focus on prepackaged, low-calorie meals for convenience and portion control. Option B. Provide the patient with a standardized, low-carbohydrate meal plan commonly recommended for diabetes management, emphasizing the need to strictly adhere to it for optimal blood glucose control. Option C. Give the patient a list of common Western-style healthy foods and encourage them to substitute these for their traditional dishes, assuming this will be easier to manage for diabetes. Option D. Collaboratively explore the patient's traditional recipes, identifying opportunities to modify ingredients or portion sizes to align with diabetes management goals, while also discussing affordable healthy food options available in their community. The correct answer is D. Collaboratively explore the patient's traditional recipes, identifying opportunities to modify ingredients or portion sizes to align with diabetes management goals, while also discussing affordable healthy food options available in their community. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified diabetes educator (CDE) to adapt nutrition education strategies to meet the unique cultural, socioeconomic, and linguistic needs of a diverse patient population. A one-size-fits-all approach is ineffective and can lead to poor health outcomes, patient disengagement, and potential health disparities. The CDE must demonstrate cultural humility and a commitment to equitable care. Correct approach analysis. The correct approach involves a collaborative and culturally sensitive process. It prioritizes understanding the patient's lived experiences, food traditions, and access to resources. This aligns with ethical principles of patient-centered care and the professional responsibility to provide education that is accessible, understandable, and actionable. By involving the patient in developing personalized strategies, the CDE fosters autonomy and self-efficacy, which are crucial for long-term adherence to diabetes management plans. This approach respects individual dignity and promotes health equity, a core tenet of professional practice. Incorrect approach is analysis. One incorrect approach involves providing generic, standardized dietary guidelines without considering the patient's background. This fails to acknowledge the diversity of the patient population and can be perceived as culturally insensitive or irrelevant, leading to low engagement and adherence. It violates the ethical obligation to provide individualized care and can exacerbate health disparities by not addressing specific barriers. Another incorrect approach is to assume that all patients from a particular cultural group share the same dietary practices or beliefs. Stereotyping can lead to misinterpretations and the imposition of inappropriate recommendations. It demonstrates a lack of cultural humility and can alienate patients, hindering the development of a trusting therapeutic relationship. Ethically, it is a failure to respect individual differences. A third incorrect approach is to focus solely on the ideal or recommended diet without exploring the patient's current eating patterns, food availability, and cooking methods. This overlooks practical realities and can create unrealistic expectations, leading to frustration and discouragement. It is a failure to provide practical, sustainable education and can be seen as a lack of empathy and understanding of the patient's circumstances. Professional reasoning. When faced with diverse populations, CDEs should employ a systematic, patient-centered approach. This begins with active listening and open-ended questioning to understand the patient's cultural background, food preferences, cooking skills, socioeconomic status, and access to food. The CDE should then collaboratively identify culturally relevant and practical food choices that align with diabetes management goals. Utilizing visual aids, translated materials, and community resources can further enhance understanding and accessibility. Regular follow-up and ongoing assessment are essential to adapt strategies as needed, ensuring the education remains relevant and effective. This process emphasizes respect, collaboration, and cultural competence. Question 11. Market research demonstrates that individuals with diabetes often present with a constellation of symptoms that can overlap with other medical conditions. A certified diabetes educator, CDE, is working with a patient who has a long-standing diagnosis of type 2 diabetes and is currently experiencing new onset of significant fatigue, unexplained weight loss, and increased thirst, which are also symptoms that could indicate other serious conditions. The CDE has provided education on diabetes management and self-care. What is the most appropriate course of action for the CDE in this situation? Option A. Advise the patient to increase their insulin dosage and monitor blood glucose levels more frequently, assuming the symptoms are due to hyperglycemia. Option B. Suggest the patient try a new dietary regimen focusing on reduced carbohydrate intake, as this often resolves unexplained weight loss and fatigue. Option C. Reassure the patient that these symptoms are common in individuals with diabetes and will likely resolve on their own with continued adherence to their current management plan. Option D. Recommend that the patient schedule an appointment with their physician for a comprehensive medical evaluation to investigate the new symptoms. The correct answer is A. Advise the patient to increase their insulin dosage and monitor blood glucose levels more frequently, assuming the symptoms are due to hyperglycemia. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified diabetes educator, CDE, to move beyond their primary role of diabetes management education and delve into the complex realm of differential diagnosis. Misinterpreting symptoms or failing to consider alternative conditions can lead to delayed or incorrect treatment, potentially harming the patient and eroding trust. The CDE must balance their expertise in diabetes with an awareness of other conditions that can mimic or coexist with diabetes, understanding the limits of their scope of practice while ensuring patient safety. Correct approach analysis. The correct approach involves recognizing the limitations of the CDE's scope of practice and initiating a referral to a physician or other qualified healthcare provider for definitive diagnosis. This aligns with professional ethical guidelines and regulatory frameworks that mandate CDEs to practice within their competency and to refer patients to appropriate medical professionals when diagnostic uncertainty or conditions outside their expertise arise. The CDE's role is to educate and support patients with diagnosed diabetes, not to independently diagnose new or complex conditions. This ensures the patient receives accurate medical assessment and management from a licensed physician. Incorrect approaches analysis. One incorrect approach is to assume the symptoms are solely related to poorly controlled diabetes and adjust diabetes management strategies without a physician's evaluation. This is a regulatory and ethical failure because it constitutes practicing medicine without a license and can lead to misdiagnosis, delayed treatment of a different condition, and potential patient harm. It violates the principle of practicing within one's scope of competence. Another incorrect approach is to dismiss the patient's symptoms as unrelated to diabetes and offer no further guidance. This is an ethical failure as it neglects the patient's concerns and potentially overlooks a serious underlying condition. While not practicing medicine, it demonstrates a lack of professional responsibility to ensure the patient receives appropriate medical attention when presenting with concerning symptoms. A third incorrect approach is to attempt to diagnose the condition based on limited information and personal experience without consulting a physician. This is a significant regulatory and ethical violation, as it directly infringes upon the physician's role in diagnosis and can lead to severe patient harm due to an incorrect or incomplete diagnosis. It represents a clear overstep of the CDE's professional boundaries. Professional reasoning. When faced with a patient presenting with symptoms that could indicate a condition other than or in addition to diabetes, a CDE should follow a structured decision-making process. First, actively listen to and document the patient's reported symptoms and concerns. Second, assess if these symptoms are consistent with known complications or variations of diabetes management. Third, if there is any doubt or if symptoms suggest a condition outside the scope of diabetes management, the primary professional responsibility is to refer the patient to their physician or a qualified healthcare provider for a comprehensive medical evaluation and diagnosis. The CDE should then collaborate with the physician, providing relevant diabetes management information and support as directed. This process prioritizes patient safety, adheres to professional boundaries, and upholds regulatory and ethical standards. Question 12. The evaluation methodology shows that a patient with type 2 diabetes expresses strong beliefs about the goodness of certain fats and the badness of all carbohydrates, citing traditional family dietary practices. The certified diabetes educator needs to address the patient's understanding of macronutrient roles to improve their diabetes management. Which of the following approaches best facilitates this educational goal while respecting patient autonomy and cultural context? Option A. Gently explore the patient's beliefs about fats and carbohydrates, explaining how different macronutrients affect blood glucose levels and overall health, and collaboratively identify ways to incorporate balanced macronutrient intake that aligns with their cultural practices and diabetes management goals. Option B. Directly challenge the patient's beliefs by presenting scientific literature that refutes their notions about fats and carbohydrates, emphasizing that adherence to established dietary guidelines is paramount for diabetes control. Option C. Validate the patient's cultural beliefs about fats without further exploration, and suggest they continue their current dietary pattern, focusing solely on medication adherence to manage their diabetes. Option D. Focus exclusively on the carbohydrate content of foods, as this is the primary driver of blood glucose, and advise the patient to significantly reduce all carbohydrate intake regardless of the food source or their cultural preferences. The correct answer is A. Gently explore the patient's beliefs about fats and carbohydrates, explaining how different macronutrients affect blood glucose levels and overall health, and collaboratively identify ways to incorporate balanced macronutrient intake that aligns with their cultural practices and diabetes management goals. Explanation. This scenario is professionally challenging because it requires the certified diabetes educator, CDE, to navigate a patient's deeply ingrained dietary beliefs that may not align with evidence-based diabetes management guidelines. The CDE must balance respecting patient autonomy and cultural practices with the imperative to provide safe and effective care that promotes optimal glycemic control and prevents complications. The challenge lies in identifying the root cause of the patient's resistance and finding a culturally sensitive and practical approach to modify their understanding and behaviors regarding macronutrient roles. The correct approach represents best professional practice because it prioritizes a collaborative and educational strategy. By acknowledging the patient's current understanding and gently introducing evidence-based information about the impact of carbohydrates, proteins, and fats on blood glucose, the CDE fosters trust and empowers the patient to make informed decisions. This aligns with ethical principles of beneficence and non-maleficence, ensuring the patient receives care that is both beneficial and avoids harm. Furthermore, it adheres to professional guidelines that emphasize patient-centered education and shared decision-making in diabetes management. An incorrect approach that focuses solely on imposing dietary restrictions without understanding the patient's rationale fails to address the underlying issues. This could lead to patient non-adherence, mistrust, and potentially poorer health outcomes, violating the principle of beneficence. Another incorrect approach that dismisses the patient's cultural beliefs as irrelevant is ethically unsound and demonstrates a lack of cultural competence, which is crucial in healthcare. This can alienate the patient and hinder the therapeutic relationship, potentially leading to a breach of professional conduct by failing to provide culturally appropriate care. A third, incorrect approach that relies on outdated or generalized information about macronutrients, without considering individual patient needs and the latest scientific consensus, risks providing suboptimal or even harmful advice, contravening the duty of care. Professionals should employ a decision-making framework that begins with active listening and empathetic inquiry to understand the patient's perspective, beliefs, and challenges. This should be followed by a thorough assessment of the patient's current knowledge, dietary habits, and cultural context. Based on this understanding, the CDE should then develop a personalized education plan that uses clear, accessible language and evidence-based information, tailored to the patient's learning style and cultural background. The process should involve ongoing dialogue, feedback, and adjustment to ensure the patient feels supported and motivated to adopt healthier eating patterns that are sustainable and effective for their diabetes management. Question 13. Benchmark analysis indicates that a 55-year-old male patient with type 2 diabetes, a BMI of 32, and a history of non-adherence to previous lifestyle modification recommendations presents for a routine diabetes education session. The patient expresses frustration with his current blood glucose control and states, "I just don't understand why I can't get my sugar down, even when I try to eat better." As a certified diabetes educator, which of the following approaches best addresses the impact of obesity on this patient's insulin sensitivity and promotes effective self-management? Option A. Focus solely on medication adjustments with the patient's physician, explaining that lifestyle changes are unlikely to be effective given his history of non-adherence and that his obesity is primarily a genetic issue beyond his control. Option B. Initiate a detailed discussion about the physiological mechanisms by which excess visceral adipose tissue contributes to inflammation and impaired insulin signaling, and collaboratively develop a personalized, phased approach to weight management and physical activity, incorporating strategies to address potential barriers to adherence identified in previous attempts. Option C. Provide the patient with a generic pamphlet on healthy eating and encourage him to try harder to follow it, emphasizing that weight loss is the only solution for his insulin resistance. Option D. Advise the patient to immediately start a very low-calorie diet and an intense exercise program, as this is the fastest way to improve insulin sensitivity and achieve significant weight loss, regardless of his current readiness or preferences. The correct answer is C. Provide the patient with a generic pamphlet on healthy eating and encourage him to try harder to follow it, emphasizing that weight loss is the only solution for his insulin resistance. Explanation. This scenario presents a common challenge for certified diabetes educators, CDE in the United States, requiring them to integrate current evidence on the impact of obesity on insulin sensitivity into patient care plans. The challenge lies in translating complex physiological mechanisms into actionable, patient-centered advice that respects individual circumstances and adheres to established professional guidelines. Best professional practice, as guided by the American Association of Diabetes Educators, AUD, Standards of Practice and the Code of Ethics, emphasizes evidence-based care, patient autonomy, and the promotion of self-management. The correct approach involves a comprehensive assessment of the patient's current health status, lifestyle, and readiness for change, followed by the development of a personalized, collaborative plan that addresses the physiological impact of obesity on insulin sensitivity. This includes educating the patient about the mechanisms involved, e.g., visceral adipose tissue, inflammation, lipotoxicity, and discussing evidence-based strategies for weight management and improved insulin sensitivity, such as dietary modifications, physical activity, and potentially pharmacotherapy or bariatric surgery, all within the scope of practice for a CDE and in consultation with the patient's healthcare team. This approach upholds the ethical principles of beneficence, acting in the patient's best interest and non-maleficence, avoiding harm, by providing accurate, tailored information and support. It also aligns with regulatory expectations for quality diabetes education, which mandates the use of current scientific knowledge and patient-centered approaches. An incorrect approach would be to provide generic advice without considering the individual's specific needs, readiness, or the underlying physiological mechanisms. For example, simply telling a patient to lose weight without explaining the connection to insulin sensitivity or offering concrete, achievable strategies fails to meet the educational mandate of a CDE. This could be considered a failure to provide adequate and individualized education, potentially violating ethical obligations to promote patient understanding and self-efficacy. Another incorrect approach might be to recommend specific dietary plans or exercise regimens without a thorough assessment, or in a way that overrides the patient's preferences or capabilities, potentially leading to non-adherence or even harm, thus violating the principle of patient autonomy and potentially exceeding the CDE's scope of practice if not done in collaboration with other healthcare providers. Furthermore, failing to acknowledge or address the psychological and social determinants of health that contribute to obesity and insulin resistance would be a significant oversight, leading to an incomplete and ineffective care plan, which is contrary to the holistic approach expected of CDEs. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's current situation, including their understanding of their condition, their lifestyle, their support systems, and their readiness for change. Second, apply current evidence-based knowledge regarding the impact of obesity on insulin sensitivity and effective management strategies. Third, engage in shared decision-making with the patient, collaboratively setting realistic goals and developing a personalized plan that respects their values and preferences. Fourth, document the assessment, plan, and patient education thoroughly. Finally, ensure ongoing monitoring and follow-up, adjusting the plan as needed in collaboration with the patient and their healthcare team. Question 14. Benchmark analysis indicates that a certified diabetes educator is developing an exercise plan for a 75-year-old individual diagnosed with type 2 diabetes, osteoarthritis in their knees, and hypertension. Which of the following approaches best reflects a safe and effective strategy for this individual? Option A. A program consisting solely of brisk walking for 60 minutes daily, as it is a universally recommended form of exercise for diabetes. Option B. A program that emphasizes weightlifting with heavy loads to build significant muscle mass quickly, as this is known to improve insulin sensitivity. Option C. A high-intensity interval training, HIIT program to maximize calorie expenditure and improve cardiovascular fitness, assuming the individual can tolerate it. Option D. A program that incorporates low-impact aerobic activities like swimming or cycling, coupled with gentle strength training exercises focusing on major muscle groups, with gradual progression and regular monitoring of blood pressure and joint comfort. The correct answer is D. A program that incorporates low-impact aerobic activities like swimming or cycling, coupled with gentle strength training exercises focusing on major muscle groups, with gradual progression and regular monitoring of blood pressure and joint comfort. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Diabetes Educator, CDE, to tailor exercise recommendations for an older adult with multiple comorbidities, including osteoarthritis and hypertension. This necessitates a nuanced understanding of how different conditions interact and affect exercise tolerance and safety, going beyond generic guidelines. The CDE must balance the benefits of physical activity for diabetes management with the risks associated with the individual's specific health status, ensuring a safe and effective plan. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the individual's current physical condition, including their functional capacity, pain levels related to osteoarthritis, and blood pressure response to activity. It emphasizes low-impact aerobic exercises and strength training tailored to their limitations, with a focus on gradual progression and monitoring. This aligns with best professional practice by adhering to evidence-based guidelines for exercise in older adults with diabetes and comorbidities, promoting safety, efficacy, and patient-centered care. The approach respects the individual's autonomy by involving them in goal setting and education, fostering adherence and self-management. Incorrect approaches analysis. One incorrect approach involves recommending high-impact exercises without considering the osteoarthritis, which could exacerbate joint pain and inflammation, leading to injury and reduced adherence. This fails to meet the standard of care for individuals with joint issues and diabetes. Another incorrect approach is to suggest a generic exercise program without assessing the individual's current fitness level or considering their hypertension. This could lead to unsafe increases in blood pressure during exercise, posing a significant cardiovascular risk and violating the principle of do no harm. A third incorrect approach is to solely focus on aerobic activity and neglect strength training, which is crucial for maintaining muscle mass, improving insulin sensitivity, and supporting joint health in older adults with diabetes and osteoarthritis. This incomplete approach misses key components of a holistic exercise plan. Professional reasoning. When faced with such a scenario, a CDE should employ a systematic decision-making process. This begins with a thorough patient assessment, gathering information about their medical history, current medications, lifestyle, functional status, and personal preferences. Next, the CDE should consult current, evidence-based guidelines for exercise in individuals with diabetes and relevant comorbidities, such as those from the American Diabetes Association or national health organizations. The plan should then be individualized, collaboratively developed with the patient, and include clear instructions for exercise type, intensity, duration, frequency, and precautions. Ongoing monitoring and regular reassessment are essential to adjust the plan as needed and ensure continued safety and effectiveness. Question 15. The efficiency study reveals that a certified diabetes educator, CDE, is working with a new patient who expresses a strong commitment to a vegetarian lifestyle for personal and ethical reasons. The patient is seeking guidance on how to manage their type 2 diabetes effectively within this dietary framework. The CDE needs to develop a personalized nutrition plan. Which of the following represents the most appropriate initial approach for the CDE? Option A. Explore the patient's current vegetarian eating patterns. Identify potential nutrient concerns within a vegetarian diet relevant to diabetes management, and collaboratively develop strategies to ensure adequate nutrient intake and blood glucose control. Option B. Acknowledge the patient's vegetarian preference but focus solely on general diabetes education without delving into specific dietary modifications, as dietary advice is outside the CDE scope. Option C. Provide the patient with a generic vegetarian meal plan that is low in carbohydrates, assuming this will be the most effective approach for diabetes management. Option D. Advise the patient that a vegetarian diet is generally not recommended for individuals with diabetes, and immediately suggest a standard Mediterranean diet with lean protein sources. The correct answer is A. Explore the patient's current vegetarian eating patterns. Identify potential nutrient concerns within a vegetarian diet relevant to diabetes management, and collaboratively develop strategies to ensure adequate nutrient intake and blood glucose control. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified diabetes educator, CDE, to navigate a patient's deeply held personal beliefs and cultural practices while ensuring their diabetes management plan is safe, effective, and nutritionally sound. The CDE must balance the patient's autonomy with the imperative to provide evidence-based care, avoiding assumptions and respecting individual choices. The challenge lies in tailoring dietary recommendations to a specific lifestyle without compromising glycemic control or overall health. Correct approach analysis. The correct approach involves a collaborative and individualized strategy. It prioritizes understanding the patient's specific reasons for choosing a vegetarian diet, their current food intake patterns, and their knowledge of nutrient sources within that framework. The CDE then uses this information to identify potential nutrient deficiencies, e.g., vitamin B12, iron, omega-3 fatty acids, and develop strategies to address them through fortified foods or appropriate supplementation, all within the context of a balanced vegetarian eating pattern that supports diabetes management. This aligns with ethical principles of patient-centered care and professional guidelines that emphasize personalized education and support. It respects the patient's dietary choices while ensuring their health needs are met, fostering trust and adherence. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's vegetarian preference and immediately recommending a standard, omnivorous Mediterranean or low-carb diet. This fails to respect patient autonomy and can lead to disengagement and mistrust. Ethically, it violates the principle of beneficence by not considering the patient's values and potentially causing distress. From a professional practice standpoint, it demonstrates a lack of cultural competence and individualized care, which are foundational to effective diabetes education. Another incorrect approach is to simply approve the vegetarian diet without further inquiry or guidance. This is problematic because a poorly planned vegetarian diet can be deficient in essential nutrients crucial for overall health and diabetes management, such as vitamin B12, iron, zinc, and omega-3 fatty acids. It also might not adequately address carbohydrate intake for glycemic control. This approach risks patient harm by failing to provide necessary education and support, potentially leading to micronutrient deficiencies or suboptimal blood glucose levels, which is a failure of the CDE's duty of care. A third incorrect approach is to impose a strict low-carbohydrate vegetarian diet without assessing the patient's readiness, understanding, or potential for nutrient deficiencies. While low-carb can be beneficial for some individuals with diabetes, a restrictive vegetarian low-carb diet can be particularly challenging to balance nutritionally and may not be sustainable or appropriate for everyone. This approach lacks the necessary assessment and personalization, potentially leading to an unhealthy or unsustainable eating pattern. It disregards the need for a gradual, supportive transition and fails to consider the patient's individual circumstances and preferences. Professional reasoning. The professional decision-making process should begin with active listening and a thorough assessment of the patient's current dietary habits, understanding of nutrition, cultural or personal motivations for their chosen diet, and their specific diabetes management goals. The CDE should then collaboratively explore how to best integrate their dietary preferences with evidence-based diabetes management principles. This involves identifying potential nutritional gaps and developing practical, sustainable strategies to address them, always prioritizing patient safety, autonomy, and adherence. The CDE's role is to educate, empower, and support the patient in making informed choices that promote both their diabetes control and overall well-being. Question 16. The control framework reveals that a certified diabetes educator is working with a patient who expresses significant reluctance to perform self-monitoring of blood glucose, SMBG, due to perceived inconvenience and a belief that it is an unnecessary burden. The CDE needs to determine the most appropriate course of action to ensure effective diabetes management. Which of the following approaches best aligns with professional standards and ethical practice for a CDE in this situation? Option A. Recommend that the patient discontinue SMBG and rely solely on periodic A1C tests and the healthcare provider's clinical judgment for diabetes management decisions. Option B. Inform the patient that SMBG is a mandatory component of diabetes care and require them to adhere to a prescribed monitoring schedule, regardless of their personal feelings or perceived inconvenience. Option C. Engage the patient in a discussion to understand their specific concerns about SMBG, explore potential barriers to its implementation, and collaboratively develop a personalized SMBG plan that addresses their lifestyle and preferences, emphasizing how SMBG data can empower them to make informed decisions about their diabetes management. Option D. Provide the patient with a standard pamphlet on the importance of SMBG and instruct them to read it at their convenience, assuming they will eventually understand its value and begin monitoring. The correct answer is C. Engage the patient in a discussion to understand their specific concerns about SMBG, explore potential barriers to its implementation, and collaboratively develop a personalized SMBG plan that addresses their lifestyle and preferences, emphasizing how SMBG data can empower them to make informed decisions about their diabetes management. Explanation. This scenario is professionally challenging because it requires the Certified Diabetes Educator, CDE, to balance patient autonomy with the imperative of effective diabetes management, particularly concerning the foundational role of self-monitoring of blood glucose, SMBG. The CDE must consider the patient's expressed preferences and potential barriers, while ensuring that the recommended care plan is evidence-based and aligned with professional standards for diabetes education. The patient's resistance to SMBG, citing inconvenience, presents a common but significant hurdle that necessitates a nuanced and empathetic approach. The correct approach represents best professional practice because it prioritizes a collaborative and educational strategy. By exploring the patient's specific concerns and tailoring the SMBG education to their lifestyle, the CDE upholds the ethical principle of patient-centered care and promotes informed decision-making. This approach acknowledges that SMBG is a critical tool for understanding glucose patterns, identifying triggers for hyperglycemia or hypoglycemia, and evaluating the effectiveness of treatment regimens, all of which are essential for achieving optimal glycemic control and preventing long-term complications. The CDE's role is to empower the patient with the knowledge and skills to manage their diabetes effectively, and this includes understanding and utilizing SMBG. This aligns with the core competencies of a CDE, which include patient education, motivational interviewing, and the application of evidence-based practices. An incorrect approach that focuses solely on mandating SMBG without addressing the patient's concerns would be professionally unacceptable. This would fail to respect patient autonomy and could lead to non-adherence, undermining the therapeutic relationship and potentially worsening glycemic control. Ethically, it breaches the principle of beneficence by not adequately considering the patient's individual needs and barriers to care. Furthermore, it neglects the regulatory expectation that CDEs provide education that is understandable and actionable for the patient. Another incorrect approach that dismisses SMBG entirely in favor of other monitoring methods, without a thorough assessment of the patient's suitability for those alternatives, would also be professionally unsound. This could lead to a loss of critical real-time glucose data that SMBG provides, potentially delaying the identification of dangerous glucose fluctuations. It might also overlook the cost-effectiveness and accessibility of SMBG for many individuals. A third incorrect approach that involves providing generic information about SMBG without actively engaging the patient in problem-solving or skill-building would be insufficient. While informative, it fails to address the patient's specific barriers and may not equip them with the confidence or practical strategies needed to integrate SMBG into their daily routine. This falls short of the CDE's responsibility to ensure comprehension and application of educational content. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and validate the patient's concerns. Second, assess the underlying reasons for resistance to SMBG. Third, provide tailored education on the benefits and practical application of SMBG, addressing specific barriers. Fourth, collaboratively set realistic goals for SMBG frequency and timing. And fifth, regularly review and adjust the SMBG plan based on the patient's experience and glycemic outcomes, always adhering to established clinical guidelines and ethical principles of patient care. Question 17. Quality control measures reveal that a patient diagnosed with type 2 diabetes, who is experiencing persistent hyperglycemia despite adherence to a prescribed oral medication and lifestyle modifications, has laboratory results indicating elevated fasting glucose and HbA1c, alongside evidence of impaired insulin secretion. Considering the established pathophysiological mechanisms of type 2 diabetes, which of the following explanations best guides the CDE's approach to patient education regarding the current treatment challenges? Option A. The patient's hyperglycemia is primarily due to the body's reduced ability to effectively use insulin, a condition known as insulin resistance, which the current medication aims to improve. Option B. The patient's hyperglycemia is a direct consequence of the progressive decline in the pancreas's ability to produce sufficient insulin, a key factor in managing blood glucose levels. Option C. The patient's hyperglycemia is a complex interplay between the body's decreased sensitivity to insulin and a gradual impairment in the pancreas's capacity to secrete adequate insulin. Option D. The patient's hyperglycemia is solely attributable to dietary indiscretions, and the medication is not effectively counteracting the impact of food intake on blood glucose. The correct answer is A. The patient's hyperglycemia is primarily due to the body's reduced ability to effectively use insulin, a condition known as insulin resistance, which the current medication aims to improve. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Diabetes Educator, CDE, to interpret complex pathophysiological findings in the context of a patient's specific presentation and potential treatment implications. The challenge lies in moving beyond a superficial understanding of diabetes mechanisms to a nuanced application that directly impacts patient care and education, ensuring that the educator's advice is both accurate and aligned with current best practices and regulatory expectations for patient safety and efficacy of care. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the underlying pathophysiological mechanisms contributing to the patient's hyperglycemia and potential complications. By focusing on the interplay of insulin resistance and impaired beta cell function, the CDE can tailor educational strategies to address the root causes of the patient's condition. This aligns with the ethical imperative to provide evidence-based, individualized care and the regulatory expectation that CDEs possess a deep understanding of diabetes pathophysiology to effectively guide patient self-management and prevent adverse outcomes. This approach prioritizes a comprehensive understanding that informs targeted interventions. Incorrect approaches analysis. One incorrect approach fails to acknowledge the dual nature of type 2 diabetes pathophysiology, focusing solely on insulin resistance. This is professionally unacceptable, as it leads to an incomplete understanding of the patient's condition and may result in educational strategies that are not fully effective, potentially overlooking the progressive decline in insulin secretion. This could be seen as a failure to provide comprehensive care, potentially violating professional standards that require a thorough assessment of all contributing factors. Another incorrect approach oversimplifies the pathophysiology by attributing all issues solely to lifestyle factors, without considering the underlying cellular and hormonal dysregulation. This is ethically problematic as it may lead to patient blame and a lack of appropriate medical management, potentially delaying or preventing access to necessary pharmacological interventions. It also fails to meet the regulatory expectation of providing education grounded in scientific understanding of the disease process. A further incorrect approach focuses on a single, isolated symptom without connecting it to the broader pathophysiological cascade. This is professionally unsound because it neglects the systemic nature of diabetes and its complex mechanisms. It can lead to a fragmented approach to education and management, failing to equip the patient with a holistic understanding of their condition and how different factors interact, thus not meeting the standard of care expected of a CDE. Professional reasoning. Professionals should approach such situations by first conducting a thorough assessment of the patient's clinical data, including laboratory results and medical history, to identify the specific pathophysiological derangements. This should be followed by an analysis of how these derangements manifest in the patient's symptoms and overall health status. The CDE should then consider the most current, evidence-based understanding of diabetes pathophysiology relevant to the patient's type of diabetes and stage of the disease. Educational interventions should be directly linked to these pathophysiological insights, empowering the patient to understand the why behind their management strategies. This decision-making process ensures that education is not only informative, but also actionable and tailored to the individual's unique needs, adhering to professional standards and regulatory requirements for safe and effective diabetes education. Question 18. The risk matrix shows a patient experiencing recurrent episodes of severe hypoglycemia, despite consistent adherence to their prescribed basal bolus insulin regimen and regular meal patterns. The patient reports feeling increasingly unable to recognize the early warning signs of low blood sugar. Considering the certified diabetes educator's scope of practice and the need for a comprehensive understanding of glucose homeostasis, which of the following is the most critical area to explore to address this persistent challenge? Option A. The patient's social support system and their ability to assist during hypoglycemic emergencies. Option B. The potential for alternative, non-pharmacological dietary supplements that might indirectly influence blood glucose stability. Option C. The patient's body's physiological response to hypoglycemia, specifically the function and potential impairment of glucagon and other counterregulatory hormones. Option D. The patient's psychological coping mechanisms for managing the anxiety associated with frequent hypoglycemic events. The correct answer is C. The patient's body's physiological response to hypoglycemia, specifically the function and potential impairment of glucagon and other counterregulatory hormones. Explanation. The risk matrix shows a patient experiencing recurrent hypoglycemia despite adherence to their prescribed insulin regimen. This scenario is professionally challenging because it requires the certified diabetes educator, CDE, to move beyond basic medication management and delve into the complex physiological responses to low blood glucose, specifically the role of counterregulatory hormones. Understanding these hormones is crucial for identifying the root cause of the persistent hypoglycemia and developing an effective, individualized management plan. The correct approach represents best professional practice because it directly addresses the physiological mechanisms underlying hypoglycemia by focusing on the role of glucagon and other counterregulatory hormones, like epinephrine, cortisol, and growth hormone. The CDE can assess the patient's body's natural defense mechanisms against falling blood glucose. A diminished or blunted counterregulatory response can significantly increase the risk and severity of hypoglycemia, making it harder for the patient to recognize and treat. Educating the patient about these hormones, their functions, and how they are affected by factors like insulin dosage, meal timing, and exercise is essential for empowering them to manage their condition effectively. This aligns with the professional responsibility to provide comprehensive diabetes education that considers the patient's complete physiological state and promotes self-management. An incorrect approach that focuses solely on adjusting insulin dosage without considering the counterregulatory hormone response fails to address the potential underlying issue. This could lead to a cycle of dose adjustments that may not resolve the problem and could even exacerbate it if the body's ability to respond to further drops in glucose is compromised. This approach is professionally unacceptable as it neglects a critical component of glucose homeostasis and may violate the ethical principle of providing competent and evidence-based care. Another incorrect approach that dismisses the patient's symptoms as solely behavioral or psychological, without investigating the physiological basis, is also professionally unacceptable. This demonstrates a failure to conduct a thorough assessment and could lead to misdiagnosis and inappropriate treatment, potentially causing harm to the patient. It also undermines the patient's experience and trust in the healthcare provider. A third incorrect approach that involves recommending over-the-counter supplements without understanding their potential impact on glucose metabolism or their interaction with prescribed diabetes medications is dangerous and unprofessional. This bypasses established medical protocols and could lead to unpredictable and harmful effects on blood glucose control, violating the duty to provide safe and effective care. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough patient assessment. This includes a detailed history, physical examination, review of current medications, and understanding of the patient's lifestyle and adherence. 2. Physiological understanding. Apply knowledge of glucose metabolism, including the roles of insulin and counterregulatory hormones. 3. Differential diagnosis. Consider all potential causes for the observed symptoms, prioritizing physiological factors. 4. Evidence-based interventions. Develop a management plan based on current scientific evidence and best practices. 5. Patient education and empowerment. Ensure the patient understands their condition and the rationale behind the treatment plan, enabling them to participate actively in their care. 6. Ongoing monitoring and adjustment. Regularly assess the effectiveness of the plan and make necessary modifications. Question 19. Stakeholder feedback indicates a need for improved patient understanding of insulin titration. When discussing adjustments to basal insulin with a patient newly diagnosed with type 2 diabetes, which approach best facilitates safe and effective self-management? Option A. Present a standardized, pre-printed titration schedule that outlines daily adjustments based on a fixed algorithm, instructing the patient to follow it precisely without deviation. Option B. Provide a detailed explanation of how their current basal insulin dose is intended to maintain fasting glucose levels. Review their recent fasting glucose readings together, and collaboratively establish a clear, stepwise plan for increasing the dose by a specific unit amount if fasting glucose remains above target, emphasizing the importance of continued monitoring and reporting any symptoms of hypoglycemia. Option C. Briefly mention that basal insulin needs to be adjusted over time and suggest they consult their physician if they experience any significant issues. Option D. Advise the patient to adjust their basal insulin dose based on how they feel throughout the day, encouraging them to make changes whenever they perceive their blood sugar might be high. Correct answer is B. Provide a detailed explanation of how their current basal insulin dose is intended to maintain fasting glucose levels. Review their recent fasting glucose readings together, and collaboratively establish a clear, stepwise plan for increasing the dose by a specific unit amount if fasting glucose remains above target, emphasizing the importance of continued monitoring and reporting any symptoms of hypoglycemia. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing patient-specific factors, evolving clinical guidelines, and the need for clear, actionable patient education regarding insulin titration. The educator must navigate potential patient anxiety, varying levels of health literacy, and the inherent complexity of insulin therapy to ensure safe and effective self-management. The educator's role is to empower the patient to participate actively in their treatment plan, which necessitates a thorough understanding of the rationale behind titration adjustments. Correct approach analysis. The correct approach emphasizes a collaborative, patient-centered strategy. It aligns with best professional practice by prioritizing patient understanding and shared decision-making, which are fundamental ethical principles in healthcare. This approach ensures the patient comprehends the why behind insulin adjustments, fostering adherence and self-efficacy. It also adheres to regulatory guidelines that mandate informed consent and patient education for effective disease management. By focusing on the patient's individual response and providing clear, stepwise instructions, the educator promotes safe and effective insulin titration, minimizing the risk of hypoglycemia or hyperglycemia. Incorrect approaches analysis. One incorrect approach fails to adequately explain the rationale for titration, leaving the patient feeling disempowered and potentially leading to non-adherence or incorrect adjustments. This violates the ethical principle of patient autonomy and the regulatory requirement for adequate patient education. Another incorrect approach relies solely on a rigid, one-size-fits-all titration schedule without considering the patient's individual glucose patterns, lifestyle, or potential barriers. This is professionally unacceptable as it disregards patient-specific needs and can lead to suboptimal glycemic control and increased risk of adverse events, contravening professional standards of care. A third incorrect approach oversimplifies the process, potentially omitting crucial safety information about recognizing and managing hypoglycemia, which is a significant ethical and regulatory failure, as patient safety must be paramount. Professional reasoning. Professionals should employ a systematic approach that begins with assessing the patient's current understanding and readiness to learn. This involves active listening and open-ended questioning. Next, the educator should clearly explain the goals of insulin therapy and the rationale for titration, linking it to the patient's individual glucose monitoring data. Then, a stepwise, personalized titration plan should be developed collaboratively, ensuring the patient understands each step, the expected outcomes, and how to monitor for efficacy and side effects. Finally, a plan for follow-up and ongoing support should be established, reinforcing the patient's ability to manage their insulin regimen safely and effectively. Question 20. The performance metrics show a patient presenting with symptoms that could indicate either microvascular or macrovascular complications of diabetes. The patient reports intermittent chest tightness and occasional blurred vision. Their recent HbA1c was 8.5%. Which of the following actions is the most appropriate next step for the certified diabetes educator? Option A. Conduct a detailed assessment of cardiovascular risk factors and symptoms, and refer the patient for immediate cardiology evaluation due to the chest tightness. Option B. Advise the patient to rest and drink water, suggesting their symptoms are likely due to stress and dehydration, and to monitor their blood glucose levels. Option C. Educate the patient on the importance of glycemic control for preventing retinopathy and schedule a follow-up appointment to monitor their vision. Option D. Focus on educating the patient about the long-term effects of hyperglycemia on kidney function and schedule a urine microalbumin test. The correct answer is A. Conduct a detailed assessment of cardiovascular risk factors and symptoms, and refer the patient for immediate cardiology evaluation due to the chest tightness. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified diabetes educator, CDE, to interpret a patient's clinical data in the context of long-term diabetes complications, specifically differentiating between microvascular and macrovascular risks. The patient's presentation, with symptoms suggestive of both, necessitates a nuanced understanding of pathophysiology and risk stratification. The CDE must avoid making assumptions and instead rely on evidence-based assessment to guide appropriate referral and management, ensuring patient safety and adherence to professional standards of care. Correct approach analysis. The correct approach involves a comprehensive assessment that prioritizes identifying the most immediate and severe risks while also considering the broader long-term implications. This aligns with the CDE's role in patient education and management, which includes risk assessment and facilitating appropriate referrals. By focusing on a thorough clinical evaluation, including a detailed history, physical examination, and review of diagnostic tests, the CDE can accurately differentiate between microvascular and macrovascular complications. This systematic approach ensures that the patient receives timely and targeted interventions, which is a cornerstone of best professional practice in diabetes management, and directly supports the goal of preventing or delaying disease progression and its associated morbidities, as mandated by professional guidelines for CDEs. Incorrect approaches analysis. Focusing solely on one type of complication without a thorough assessment is a significant regulatory and ethical failure. For instance, if the CDE only considers microvascular complications and overlooks potential macrovascular disease, they risk missing a critical diagnosis that could lead to acute cardiovascular events, violating the duty of care. Conversely, prioritizing macrovascular assessment to the exclusion of microvascular signs could delay treatment for conditions like retinopathy or nephropathy, impacting long-term quality of life and potentially leading to irreversible damage. Making a presumptive diagnosis without adequate investigation is unprofessional and can lead to misdiagnosis and inappropriate treatment plans, which is contrary to the ethical obligations of a healthcare professional and the regulatory requirements for CDE practice. Furthermore, providing generalized advice without a specific assessment of the patient's individual risk profile fails to meet the standard of personalized care expected of a CDE. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough patient assessment. This involves gathering comprehensive subjective and objective data, including a detailed medical history, review of current symptoms, and examination of relevant diagnostic results. The next step is to analyze this data to identify potential complications, categorizing them as microvascular or macrovascular based on clinical presentation and risk factors. Based on this analysis, the professional should then formulate a differential diagnosis and determine the most appropriate next steps, which may include further diagnostic testing, specialist referral, or targeted patient education. This iterative process of assessment, analysis, and action ensures that patient care is evidence-based, individualized, and aligned with professional standards and regulatory expectations.